Right, kia ora koutou everybody. I'd like to start by imparting a little bit of good news. We have no new COVID-19 cases in the community in New Zealand today. And in addition to that, we have some further good news that there are no new COVID-19 cases at the border in our managed isolation facilities over the last 24 hours. We've seen one case per day for the 2 days before that, which is encouraging. We've now contacted all of the former guests from the Pullman Hotel who were identified as being there at the same time as our positive cases. There are 5 people outstanding who are part of 2 family bubbles, and they are being tested today. We're sending mobile testing units to do that. Other than that, all of the remaining tests that have come back have been negative. Almost all of the staff who were at the Pullman Hotel at the same time as the positive cases have been contacted, and there are just 2 remaining who still need to be tested. A total of 3,017 tests were completed across the country yesterday. That gives us a 7-day rolling average of 6,483 tests over the last week. All results so far have from close and casual contacts of the 3 positive cases have come back as negative. And of course, this means that those in the north continue to enjoy their long weekends today. I'd like to take this opportunity to share, I guess, a little bit of a reminder about kindness and respect. It is never somebody's fault if they contract COVID-19. It is a virus. It's a tricky virus, and it could be any one of us that ends up suffering from it. When we're all following health advice and staying home and isolating if we're asked to do so, we should be applauded for doing that, not vilified, and we have seen examples of that. If people follow the health advice, others stay safe. And so I do want to extend a very warm thank you to the people who have been contacted as part of this most recent group of cases that we've been dealing with, who have isolated and who have been tested. They have done exactly what we have asked them to do. They have done their bit. Thank you to everybody involved in the testing process, from those who were getting their tests, whether they were at one of the identified locations or had symptoms or were a close contact. And thank you again to all of our health workers who have gone over and above what needed to happen to make sure that under huge pressure and in extended hours, everybody who needed a test was able to get one. Thank you also to those returnees who have had to isolate a little bit longer. It's never easy, and your efforts are appreciated. It is never helpful when we hear comments that put the tireless work of our border staff down to luck. There are thousands of people working to keep our country safe who would feel aggrieved and do feel aggrieved when they hear things like that. I want to take this opportunity once again to thank all of the staff working in our managed isolation, our quarantine facilities, and at our border. Whether they are health workers, security staff, caterers, cleaners, Defence Force personnel, couriers, the list is an extensive one, and it is not by luck that they are doing such a good job. Their efforts are the reason why New Zealand is able to continue to enjoy long weekends like the one that those in the north are experiencing this weekend. So I'll now hand over to the Director General to give a more detailed update on a few matters, and then we'll happily take questions.
Thank you, Minister. Kia ora koutou katoa. It's nice to be able to report no new cases either in managed isolation or in the community today. And in addition, one previously reported case has recovered, and further, yesterday's case that was reported as a confirmed case yesterday has now been reclassified as under investigation because it is suspected to be an historical case. So in fact, our overall numbers have gone down by 1 today. And the total number of active cases is 69, and total number of confirmed cases then is 1,947. An update on the 2 people who tested positive in the community in Auckland and were transferred to the Auckland quarantine facility. They're continuing to recover, and we can report that all the test results of close contacts to date have come back negative. Of course, those people remain in isolation for a full 14 days since their last contact with the cases, and they will be retested before they are released from that. The Minister mentioned the follow-up of our Pullman guests, and there were in total 349 people between the 9th and 24th of January who were followed up. There are 340 negative results so far, and the 5 results we are waiting for, as the Minister mentioned, 2 family groups. They have been isolating at home. It was just the best way and the most timely way to get the testing to them was today through mobile testing, and so we expect those results later today. The remaining 4 individuals to make it up to the 349 are the 2 positive cases already reported, and there are 2 young children who don't require testing because their other family members have returned negative tests. The 349 number is down from 353 last week because a small number of people have been identified as falling outside the requirement for a test subsequently. It is encouraging to see all those negative results come through and the extensive follow-up that's been done by the team here in the Ministry and our public health units on the ground has really helped to reassure us that at the moment there's no evidence of any community transmission. The Minister's mentioned the people who, on request, did what was asked, who had been in those locations of interest, around 1,500 people, who isolated, called Healthline, got a test and stayed isolated until they had the result. And again, that helps reassure us that we're not seeing any ongoing evidence of community spread. The value of using the QR codes and having Bluetooth turned on is demonstrated by, I think, what we've seen in these cases. So great to see the 7-day rolling average of QR codes up over 1 million for this last week. In Auckland today, Anniversary Day, I hope it's as nice up there as it is in Wellington today. There are 4 community testing centres open today: Northcote, Balmoral, Henderson, Otara. And also there is testing available at urgent care clinics and those general practices that are open today. The pop-up testing centre in Albany has been open over the long weekend. It's now closed, and the regional public health team reporting that demand there was dropping away. Of course, if needs be, those centres will be stood up again if required. And finally, just an update on our reporting on historical cases. As we did today, we've reported the case from yesterday is now being under investigation. To date, we've tended to report those cases that we consider are historical. We've tended to report those as part of our overall numbers. In discussion with other countries and looking at what the WHO is looking for, it is really just looking for the number of active acute cases. So I've asked my team for advice on how we might just move to reporting active and acute cases in New Zealand, while at the same time still reporting the historical cases that we are finding coming through the border. Most of those cases that we find late in someone's time in managed isolation, and indeed some that we find early, we determine are historical. And so what we're going to do is move to reporting those separately, because they are not cases that we actually need to report to the WHO, in particular because some may have already been reported in the country they have travelled from. So we will keep those cases under investigation where there is uncertainty until we've confirmed that they are historical, but we'll still continue to report that. And finally, I would like to personally reiterate the message the Minister's just given about being kind. This is something we are all in together. It has served us incredibly well to date, and it will continue to serve us well into the future. Thank you.
The situation in Perth cause concern when it comes to any potential opening of the Trans-Tasman bubble, or is their response with a harsh lockdown reassuring?
It doesn't necessarily change anything from where we were, a week ago. We know that one of the things we have to be prepared for in the event of a Trans-Tasman bubble is that there could be small outbreaks on either side of the Tasman and in any of the states of Australia. So we need to be aware, we need to have agreed protocols around what we would do in those circumstances. It doesn't necessarily mean that we won't go ahead, but it is an illustration of why we've been cautious. The Australians are cautious as well, and why we want to make sure that we've got everything in place before we would go live with a Trans-Tasman bubble.
Ensuring that they've reacted with such a harsh lockdown that kind of matches out our way of doing things?
Well, potentially in a case like that in New Zealand, we may not need to go into a lockdown, as we've just demonstrated with these 3 cases that we have dealt with over the last week, we were able to do that without having to resort to a lockdown. So I don't want to pass judgment on what any individual Australian states are doing, because I don't know all of the ins and outs of what they will be weighing up when they make those decisions. But certainly, I'd endorse the go hard, go early message has served New Zealand well. And if that's what they're doing there, then, all power to them.
So on Australia, just on Australia, do you have any advice for Kiwis at this point in terms of people wanting to get out of New Zealand and go to Australia, or thinking they need to travel to Australia? Obviously a continuing fluid situation. What's your advice to them when they are trying to make those decisions and plans at the moment?
Look, at the moment, we do not have a Trans-Tasman bubble, so we are working towards one. We haven't got a date for when we would operationalise a Trans-Tasman bubble. So anyone leaving New Zealand to go to Australia needs to do so in the knowledge that they will need to isolate in New Zealand for the full period when they return home. Now, it's possible that might change at some point in the next few months, but for now, when making their plans, they need to be working on the basis that there isn't a Trans-Tasman bubble.
I mean, they don't go, given this, the situation that we've just seen again with Perth. Is it quite...
Look, one of the things that I have, noted and noticed in the last 6 months or so that I've been doing this is that New Zealanders are a very internationally connected people. And so sometimes people do have very compelling reasons for why they need to travel, for family reasons or whatever. And I'm not going to pass judgment on anyone who feels they have to travel. I guess my advice to them would be, though, if Australia is their destination, at the moment, Australia is still another country, not part of a Trans-Tasman bubble, and so if they're doing that travel, they do so in that knowledge.
Thank you. Could you please explain why those 4 people, from 353 to the 349, why those 4 people were outside of the requirements for a test, and then wouldn't those 2 children have come into that category as well?
So I don't have the detail on those 4, but it could be, I have an understanding that one of them had subsequently travelled abroad, and it could be that they had already, because they were captured in that between 9th and 24th, they were in that group that were held back before release and further tested. But I do trust the judgment of my team in determining whether people do or don't require testing. I should say we have been very inclusive in our requirements for testing, and I did want to talk about the 2 children separately, just to be open about who has or hasn't been tested.
You also last week said you were going to follow up on the 2 South African sisters, the family that thought that they contracted COVID-19 at the Pullman. Did you get a definite or categorical result?
Not at this point in time. As last Monday, so a week ago, our team had concluded at that point that it was most likely to have been transmission during the journey to New Zealand rather than once they were in managed isolation. They are going back again to have a look at the data.
Returning negative day 3 and day 12 tests.
Yes, that's right. So that certainly can happen, and it was just one of the girls who became infected, and the genomic sequencing, and if they looked at the pattern of travel, the flight they were on, and then what happened in the managed isolation facility, that was the conclusion, but they're having another look at it, and we'll update on that.
Is it acceptable that it's taken so long to get the test results back from all of those Pullman hotel guests?
Look, it's a big undertaking. That's quite a few people. They'll be spread all over the country. We're down to 5, and we are sending people out to find them and to actually take the swabs, wherever they are.
But more than a week surely isn't gold standard or platinum standard, as you've said.
Look, I think we contacted them much sooner than that. So most of them were contacted very, very quickly. Sort of within that 48-hour period they were contacted, I think, would be about the time frame we're talking about. But it's taken a while to get some of them to get the swabs.
And how would you make that process happen faster next time around? Like, surely there's some learnings you could take from that.
Look, at the end of the day, we are reliant on people's goodwill and asking them to move quickly. To go and find 300 and something people would be a significant undertaking. Once we have given people a period of time to go and get their swabs taken, which the vast majority of them did within a timely, in a timely way, then we can follow up those who perhaps haven't been as quick coming forward.
So, as the Prime Minister noted yesterday, you would be talking to MB about that case of Trevor Ponting. Have you talked to them, and what did you tell them in terms of you were going to be asking for a review of how that happened and how that decision was made?
Yeah, so we've set out a criteria for exceptional circumstances, for compassionate consideration for people to come in through the managed isolation facilities. The criteria is clear, it's published, everybody can have access to it. There are a lot of people who apply through that, and a lot of them don't meet the threshold. I must admit, when I saw the reporting of that case, I was somewhat surprised. It didn't, strictly speaking, meet the criteria, but there were compassionate grounds to grant that particular case. So we have a review mechanism in place. That review mechanism kicked in. The case was looked at again not by me. It was looked at again, and the decision was made to approve it. I want to be clear that one of the reasons we do it this way is that it shouldn't depend who you know as to whether or not you get your case reconsidered. It shouldn't be that if you contact your local MP, you somehow get pushed up the list. These exemptions are dealt with completely separately, independently, and against the criteria. This particular case, though, fell outside the criteria, but should have, in the first instance, generated a compassionate exemption. It's now been fixed.
What assurances have you got that this won't happen again in terms of, do you think that in this situation, outside that criteria, we do need to see more compassion and flexibility? And what assurances have you got that this won't happen again?
The review mechanism is the best defence against that. So where people feel that that their exceptional circumstances haven't been properly considered, I would encourage them to use the review mechanism. It's effectively an appeal, and that it'll be considered by somebody else, a different process, just to make sure that everything is fair, and where there are genuinely extenuating circumstances that mean a case should be reconsidered, it can be. Bearing in mind too, people's circumstances change even within those applications, so things can get worse sometimes, and so someone might be declined, then something happens which makes their circumstances worse, and then they ask for it to be reconsidered, and on occasion it will be.
Mobile testing units, what is the capacity of those, and could you have rolled them out sooner last week when we were still waiting on 50 tests so that we felt a little bit more confident going into a long weekend in Auckland?
I'll ask the Director General to comment on that.
Look, there is certainly capacity from the mobile units. I should say that, as the Minister said, all of the people who left the Pullman, all of them, and we had a complete list, were able to be contacted within about a 48-hour period. So that's actually what we would be looking to achieve. Those folk who hadn't been tested, and including the remaining ones who have been tested today, have been isolating. And it was Friday when we still had a small number of outstanding test results. We weren't sure if people had been tested, and some of them had, but we just didn't have the results. That we mobilised the public health units to go out and find people, then, if necessary, to actually organise the mobile testing. The point being that they were isolating while they were awaiting the testing to happen.
Tova.
Will the government be standing up any more MIQs given the temporary closure of the Pullman, and also we keep hearing these stories about Kiwis overseas who can't get home?
No, we're sitting at around that 4,500 mark, 4,500 rooms. We continue to be at making 4,500 rooms available, even with the Pullman coming offline. It will be offline for probably up until about the 15th. So it should be empty by Saturday. The last guest should leave the Pullman by Saturday. It'll stay empty at least until the 15th. We'll make a decision in the intervening period about exactly what the date is that we start putting people back in there. But in that period of time, systems will be upgraded there, so we'll make sure the CCTV upgrade has been completed. It's actually easier to do when there's no one there, so that will happen, and we'll be doing a thorough review of all of the systems and processes around the Pullman before we start to fill it up again.
Is that also assuming that you would only open it if you figure out how those cases were transmitted within the Pullman in the first place?
Not necessarily. We wouldn't necessarily need a precise answer. We do know that from other cases, we've not been able to absolutely give a 100%, confirmed view of what happened. If you recall back to our maintenance worker, where the lift was involved there, maybe the lift button, maybe aerosol transmission within the lift. We never got a 100% conclusive answer there, but we ended up with a likely scenario, and it may well be that that's where we land up with these as well.
Do you have any update on the environmental testing from ESR on that?
I'm expecting to get the final results of that on Wednesday.
Mr. Bloomfiled. Thank you. Just on the vaccines, has your ministry now received that urgent clarification around whether the EU issues that we've heard about would be affecting our vaccine orders?
What I would say, and the Minister may want to comment, is we're using every channel to keep up to date with and see what's happening. I mean, it's a rapidly evolving international situation.
As the Prime Minister said yesterday, we are obviously concerned by the actions of the European Union. We certainly don't endorse the course of action that they have taken. And, you know, we've expressed that concern to them, and the Prime Minister has expressed that concern to them. We've not yet been advised by any of the vaccine companies that we have advanced purchase agreements with, that their supply schedules, the timeframes under which they're expecting to deliver to New Zealand would be affected by this. So at this point, we are still working with them on the delivery schedules that were previously agreed. But as the Prime Minister said, we don't agree with the stance of the EU.
Is it a case that you haven't had them say that there's going to be a delay, or have you sought an assurance that there's not going to be a delay?
Oh, look, we're talking to them about the delivery schedules all of the time, Pfizer in particular, because that's the one that we are expecting first. Those conversations happen on an almost daily basis around what we can expect, when we can expect it. And we do have a bit of a delivery schedule over this first quarter penciled in with them. The reason that I have not made that schedule public is because it is subject to change. And I'm not going to say that, you know, we're expecting vaccines to arrive, you know, in X quantity on X date until I'm absolutely certain that that's when they're going to arrive.
Just back to the Pullman, are they going to install CCTV in the corridors, or are there some privacy issues around that?
No, there will be. So we've been progressively upgrading CCTV in all of the managed isolation facilities since we had a few issues last year, as you may recall, with people taking off. And security systems were upgraded, fencing was upgraded. We put funding into putting better CCTV in all of those facilities. The Pullman was, I think, one of the last to get the CCTV component of that upgrade package, so that will happen before we start putting people back in there again.
Just for Dr. Bloomfiled, will you, on the people who possibly contract COVID within MIQ, will you make a practice of revealing that when your investigations have decided that they did catch it within MIQ, even if they, their stay is extended?
Yes, indeed, and what the team's just finalising at the moment are the numbers that we have had over the last few months. I think the first case that we reported where we found this out is the one the Minister referred to, which was the maintenance worker which happened during the Auckland August outbreak. So some will be guests, some will be staff members, and we will first of all provide a baseline when we're confident in the figures and lay out the details of those, most of which will be already known, will have already been reported. And then as those, if we find further events where we have, in our investigations of every case where someone late in their stay returns a positive test, and we do that investigation, where we can't rule out in facility transmission, we will publish that, and also what we're doing about it. That's the important thing too.
Come back over here.
Thank you. Have you sought any assurances, or is MedSafe doing any extra work into the efficacy of AstraZeneca in over 65s?
I'll ask the Director General to comment on that.
Look, I think there is a range of views on this. And you can see experts taking a position on different sides. I should point out that the European regulatory agency has just licensed the vaccine, the AstraZeneca vaccine, for use in over 65s, and this will be something that the committee that is meeting here to look at our view of this will be looking at in due course. When we receive an application and when we have the evidence on and all the data on the AstraZeneca vaccine, the advantage we will have is if this is even in a few weeks' time, there may well be more data from its use in countries that will be able to add to the picture around efficacy in over 65s.
Okay, we'll get the last few questions.
Here
you go.
In Perth, my understanding is that there's an issue with the border worker who tested positive having a second job as a ride-share driver. Do any MIQ workers have sort of second jobs that you're aware of, and would that be against policies if that was the case in New Zealand?
Certainly the quarantine, the jet park, which is where we're dealing with where all of our positive cases end up being transferred to. We've done quite a lot to make sure that no one's moonlighting from there. One of the reasons that we moved to a directly employed security workforce rather than a contracted one, we still have some remaining legacy contracts, if you like, that have yet to run their course, but most are now directly employed, was because we know that that was an area where people were often doing multiple different roles, and so now we're employing them directly. So we have been working quite hard to make sure that doesn't happen. But there are still people who come and go from our managed isolation facilities, courier drivers, suppliers, and so on, where of course they will be in a variety of other sites as well. We do everything we can to make sure that the supply chain, is as secure as possible so that they're not at risk.
Pay them more so that they don't have to have second jobs?
Sorry, what was that?
Could we just pay them more so that they don't have to?
That's one of the reasons why we directly employed the security workforce rather than have them contracted in, because when we are responsible for their terms and conditions of employment, we can make sure that they are sufficient, that they wouldn't need another job.
And just back on the likely transmission, how is that investigation going, and how is it that we still don't seem to have any clue?
So we've still got to the environmental report from ESR, that's to come middle of this week. There's still the review. We may not ever form an absolutely 100% solid view of exactly what's happened, but what we can do is look at any identified weaknesses. We can upgrade our CCTV, we can upgrade the systems and processes there, but I'll ask the Director General to comment too.
Just an additional comment on that is last Friday we had a technical group meet off the back of finding those other 2 related cases inside the Pullman, and the conclusion of the experts on that group at the time, and that still holds, is that it's most likely airborne transmission that could have been in the corridor or in another common area. So less likely to be fomite type transmission, although the swab testing may help us rule that out or in. And so all of the actions being taken are designed to address actually any scenario whereby it may have been transmitted. But the probability is that it will be some type of airborne transmission, and it's just not possible to work out exactly where that might have happened.
I want to reiterate too that the introduction of the day 0, day 1 testing, with people being required to isolate in their rooms until they've had a negative test result on that first test, is another thing that we are doing, which of course reduces the potential for these sorts of things to happen. So in this particular case, someone arrived at the Pullman. They were then, before they had their 3-day test, were able to do the things that they'd have a degree of movement that they were able to do. And so had they been infectious when they arrived, we wouldn't have picked that up until day 3. Now we would pick that up straight away.
Is aircon theory still in play?
We still continue to look at our air conditioning systems, but the international evidence on air conditioning systems is patchy at best. Bear in mind that we're in a very unique situation in New Zealand, because we're not, in Australia too, because we're not dealing with large volumes of community cases. A lot of the studies done abroad, looking at air conditioning systems, will be doing that in the context of widespread community transmission. So the international evidence on air conditioning is not that helpful to us.
I just have 2 questions for 2 different stories. The first, the Royal College of GPs is suggesting that we look at producing vaccines here because they do have concerns with potential vaccine disruption. Could we do that?
We don't have the scale to be able to do that at this point. We were just having a conversation about that before we came here. It is something that we are looking at as to whether we should be developing the capacity to do that in the future in New Zealand. Now, for the immediate challenge, we wouldn't be able to do that in time. I mean, building these kind of plants is big, expensive and time consuming. But in terms of an overall resilience picture for New Zealand, it is certainly something that we will look to as to whether or not that's a desirable thing for us to do in the future.
And the second question being actually about National Summer Caucus today. One of their goals is for MPs to learn to trust and respect one another again. How easy do you think this would be for them, and why?
Look, the National Party's internal issues are really matters for the National Party. What I would say is I have had conversations with a number of them since the beginning of the year over COVID-19. They have been very professional and cordial conversations, and I thank them all for that.
Yeah, just on that, Judith Collins warned MPs not to get tricked into distractions such as the government baiting them into issues. Shane Retty referred to the case at the Grand Millennium last week as possibly a government bait to distract the opposition. Is that the case?
No.
Same question.
Okay.
Dr.
All right, Audrey, you can have the lucky last.
Okay, so Dr. Bloomfiled is just back on vaccines. You've mentioned several times that Australia has the licence to make them, almost implying that New Zealand could get a supply from them. Have there been any talks with Australia about them supplying New Zealand with AstraZeneca?
Yes, so Australia will be able to manufacture at their CSL facility the AstraZeneca vaccine. It's up to the company to determine where the supply comes from, but there's a very good chance, I would imagine, that when it comes to the point where the AstraZeneca vaccine is approved for use here, and then the company is going to supply it, if it is being manufactured in Australia, there's every good chance that that's where it would come from. But again, that's up to the company itself to determine that.
Go on then, you can be the very, very last.
Just if you could run through again what's going to happen tomorrow with the meeting around the vaccine approval and timelines and what we can expect.
I'll ask that.
Well, the committee, which is a ministerial advisory committee, meets tomorrow. The agenda for that meeting, I think, was made public about midday today. I'm not sure how long that meeting will go for. I imagine quite some time, because the committee will want to give the material very thorough consideration, and once that committee has reached a recommendation, they make that recommendation to the group manager of MedSafe, Chris James, and then he will make a determination off that, and of course he will be advising myself and ministers where they have landed with that result. So then it will be up to the government really, I think, to make an announcement about that.
All right, thank you very much, everybody.